Thanks for coming in today, Dr.
Pleasure.
Fleshner. So I wanted to ask you, what are the most important things, nutrition-wise, that people should do in order to prevent prostate cancer?
Well, we don't really know the science. The science of nutrition and cancer is very complex because it involves populations of people eating different things over decades, and its impact on disease, it's often very hard. But we know there are clearly dietary links to prostate cancer. We know that populations, particularly in the westernized world, where people tend to consume higher fat, higher carbohydrate type diets, that the rates and risk of not only getting but dying of prostate cancer are higher. So we know that there's either something that we are doing wrong here in the Western world or something that people out east, mostly around Asia, Southeast Asia, are doing right in terms of the way they're eating. So, and we know this is not genetic because if you look at, say, Japanese Canadians or Chinese Canadians who migrate here from those countries, sure enough, their rates start to go up once they adopt a more North American type of lifestyle. So we know that the diet does have significant impact on prostate cancer.
That's great. So what can people do? You know, you're saying adapt a more Asian diet, so would it be reducing the fat content?
Right.
What are some of the action steps?
So I mean, I think the research is changing a little bit on this topic. We focused a lot on dietary fat about 15 or 20 years ago, and we can prove, for example, in the laboratory that human prostate cancer cells do grow faster if an animal that bears those tumor cells actually consumes a high-fat diet, for example. But more and more our research is leading towards carbohydrate excess being a bigger problem. And if you look at what's happened in the North American diet over the last 15 and 20 years, there's been a big emphasis on reducing the fat content of food. And a lot of that's been replaced by carbohydrates. And of course, all that's happened is we have more and more obesity. So I think diet, certainly the heart healthy diet is typically a prostate healthy diet. So we like to keep certainly saturated fats low, certainly minimizing fried food. Certainly you want to get more vegetables and lean meats and fish in your diet. And at the end of the day, I think probably that sugar excess, pasta, rice, potatoes in excess is probably also bad in the context of prostate cancer.
Right. So it's possible that going for the higher fiber foods versus going for a white rice or refined carbohydrate.
If you want to have some carbohydrates, and you should have some, you want to have those that have low glycemic index, meaning slowly absorbed into the body, so you don't get that insulin rush, which we think is perhaps playing a role in making tumors grow faster.